Progeria,
the aging killer,
a presentation by Cyrus nagra.
and Abrez.
Though it is still a very devastating disease,
Progeria is a rare and uncommon disease that affects only 1 in 8 million people.
that's equivalent to 0.0000013% of the world's population. Causes.
This is an example of a normal person's healthy lamina gene, which is found inside the first chromosome.
This is an example of somebody's lamina gene of who is struggling with progeria. As we can see, there's an evident mutation on one of the nucleotides in the first chromosome. In this comparison of the two lamina genes, it is nearly impossible to tell which one is healthier and which one is suffering from the mutation. However,
this minute difference in the lamina gene of the first chromosome is what causes the fatal disease progeria.
inheritance pattern.
Progeria is a sporadic autosomal dominant mutation. This means it's almost always a new mutation in the family and is rarely passed down due to it being fatal.
Parents have not given birth to a child with progeria. Their chances of giving birth to a child with progeria would be 1 in 8 million, which is equivalent to below 1%. However, if the parents have already given birth to a child who is suffering from progeria, their new chances of a new child contracting the disease will increase to a whopping 2 to 3%.
Physical symptoms. The main physical symptoms of progeria include
A bigger head, large eyes, ears that stick out, a small lower jaw, a higher voice, veins you can see, slow or abnormal tooth growth, loss of body fat and muscle, and finally, hair loss.
Another major physical symptom of progeria is accelerated aging. 1 year of a child suffering from progeria is equal to about 10 years of a normal child's aging process.
In this comparison, it is evident to see that the normal nucleus of the normal child is quite different than that of the nucleus of a child suffering with progeria. It is also evident to see the physical characteristic differences between the normal child and the child with progeria. Genetic screening. For proper diagnosis, doctors will check medical records of patients as well as have them undergo a series of blood tests.
After that, doctors will determine whether or not the patient will do the diagnostic testing program for progeria. Due to the fact that the genetic mutation that causes progeria has been identified, doctors can determine whether or not the patient has progeria by analyzing the genetic code in the first chromosome. After testing the gene lamina, doctors can determine whether or not the patient has progeria by looking at the mutation if the C nucleotide is turned into a T. Population statistics. An
interesting statistic about progeria is that the progeria ratio of males versus females, males have a 1.5 higher likely chance of contracting disease than females do. Another interesting statistic is that there are only 2 people in Canada who have a confirmed case of progeria, and there are roughly estimated to be about 200 cases worldwide. Treatment. A couple of helpful tips to help with the treatment of progeria include eating a smaller quantity of food but eating more frequently throughout the day. Also wearing soft, comfortable shoes to provide cushioning for your feet, along with consuming minimum 8 glasses of water a day to keep your system fully hydrated.
Medication can also be used to help treat progeria. A drug called statins helps lower blood cholesterol, which prevents blood clots. Growth hormones can be used to build weight and height, and low dosages of aspirin can be used to prevent heart attacks and strokes.
Other forms of more advanced treatments include surgery, physiotherapy,
and farnesyltransferase inhibitors, which are a cancer drug that increase weight gain, better hearing, improve bone structure, increase flexibility of blood vessels, and affect all children.
Current research.
Although progeria is incurable, the mutation and problems caused by it are known and lead to the nucleus being unstable.
Children suffering from progeria often die at the hands of the same disease, arteriosclerosis. Arteriosclerosis is a disease that blocks the coronary arteries and limits air passage to the heart. As we can see, in a normal child's artery, it is clean and it allows perfect passage of air to the heart. But as we can see, the artery of a progeria patient, it is inflamed and filled with plaque, which limits airflow and can be detrimental to the child's health. Another astounding statistic is that the majority of progeria patients die at the whopping age of only 14 years young. Thank you for patiently listening to our presentation, and we hope that
you've left with more knowledge than when you arrived.